My name is Ludvic Zrinzo. I'm Professor of Neurosurgery at Queen Square in London. I actually decided to become a neurosurgeon when I was very young. My heart was in maths and physics, but my father was a neurosurgeon and I hated the job because I never saw him. He was working every hour that God gave. But then there was a terrible incident in Malta. There was a terrorist incident and people were being shot in the head. And he went to operate on 5 of these people who had been shot in the head and save the lives of 3 of them. And I realized that he wasn't there for a reason that was a noble one. And much to his disappointment, because I think he wanted me to be a mathematician, I decided to become a neurosurgeon as well. I've actually specialised within neurosurgery, and I fell in love with absolutely everything I did in neurosurgery. At one point, I wanted to be a vascular neurosurgeon. At another point, I wanted to be a pediatric neurosurgeon. But I fell in love with a discipline called functional neurosurgery, which is a part of neurosurgery where the brain looks normal but doesn't work normally. So a good example is Parkinson's disease. So if you did a scan of somebody with Parkinson's disease, the brain would look fairly normal compared to the scan of somebody who has a brain tumor, for example, or who has a blood clot. But of course, the brain isn't working properly, and you get symptoms like tremor or slowness of movement. And there are other conditions like severe depression or severe OCD, where the scans look normal, but the brain doesn't work normally. And I really enjoy the specialty because, number one, we can get really good results in well-selected patients. But number two, it's also an opportunity to understand the human brain in more detail, both in terms of how it works when it's healthy and what can go wrong when disease affects it. So I think I've landed on my feet in terms of enjoying working with patients, but also enjoying working with research. Oh, well, second to none. It's helping patients. I think that's amazing to be in a position to be able to help people who have been affected by disease, whose quality of life has been terribly affected, whose family's quality of life has been terribly affected. I think it's a great privilege. But I also enjoy working in a team. So it's not just the fact that I'm there helping people, but I'm also there working in a wonderful team of like-minded neurosurgeons and neurologists and speech and language therapists and nurses, all of whom are doing their very best to try and help patients with otherwise really severe disorders. And then finally, as I said before, I think I'm really fortunate to be able to do a lot of research along the way. And that means that we're always improving the therapies, always trying to get the very best results. And that's wonderful to be able to advance the field as well as advance the cause of the patient in front of you. I think it's rather presumptuous to talk about yourself through the eyes of others, but I make sure that I give patients time, and I think that's really important because I think when you're going through a condition that affects your brain, a condition that threatens your identity, threatens your perception of yourself, whether it's hemifacial spasm or trigeminal neuralgia, severe pain in the face, or Parkinson's disease, it's very distressing. And to have someone listen to you, who's really trying to understand how this disease is affecting you, and then to have a really open and honest discussion about what we can and perhaps can't help, I think that communication is perhaps the most important thing that the patients value me for, but it's also something I value in my patients. I love getting to know them as people and not just as diseases. So I think the biggest challenge of my specialisation is that very often I'm treating patients whose diseases affect their quality of life. Sometimes in other branches of neurosurgery, you're treating diseases that are threatening life itself. And therefore, when you take a small risk in neurosurgery, and there is no neurosurgical procedure that is without risk, you're doing it on the backdrop of a disease that's threatening that person's life. Whereas many of the conditions I look after are affecting quality of life, but not necessarily threatening the life of that person. So, for example, Parkinson's disease is unlikely to kill you, but you're doing an operation which in some centres has a risk of mortality. Now, we're very fortunate that we've operated on over 3,000 patients without a single mortality, but that risk is always there. So I think the biggest challenge is balancing the potential benefits, which can be very high, with the potential risks of an operation, which are very low, but are not insignificant. So I think taking that decision together with the patient to say, okay, what are our goals? Are they achievable? And are the small risks that we're going to take justified? I don't think I have a single catchphrase. There's quite a lot of them. Quite like the saying now, no other way. If you're going to do something, get it done with. The other thing is I hear a lot about medical competence, but I'm yet to come across a patient who wants a competent doctor. I think you want excellence in medicine. Every patient wants to be treated by an excellent team, and therefore that's what I strive for.